Daisy is a 2-month-old infant. Her parents are concerned because she is irritable and crying, and they are unable to comfort her. They also notice that she is not moving her left leg the same as her right leg. They take Daisy to the ER for assistance. After the MD examines Daisy, the parents are questioned regarding the injury of their daughter and the suspicion that it was purposely inflicted. Daisy's parents are confused. They don't understand how Daisy could possibly have fractured leg as the doctor claims.
Good morning, I'm Dr. Carranza.
Hi, good morning.
Hi, so what are you in here for today?
So Daisy here, she's just been really irritable and she's crying. She looks like she's in pain. When she moves, when she tries and moves in her crib, her left leg doesn't move as well as her right one, and I'm really concerned. I don't know what's wrong.
Has she fallen?
No, not that I'm aware of.
Have you dropped her?
No, not at all.
Let me take a look.
Okay.
It looks like a fracture.
A fracture? I don't know how that could happen.
Are you sure you haven't dropped her? You haven't pulled her leg?
No, I would never hurt
Too
her.
hard?
No.
Do you take care of her, or who else? Who's taking care of her right now?
I do. My husband and I do.
You're not working?
No, I don't work
Both
right
of you
now.
are home alone with her?
No, he works, but I'm home. But he helps me at night when he gets home from work.
Okay. So have you ever had depression?
No.
No? Okay, well, I'm gonna send in some, I'm gonna send her in for x-rays.
Okay.
And also I'm gonna bring in a social worker because this looks like a fracture.
Social worker?
Yes. This looks like a fracture.
I would never hurt her. Don't take her away from me.
Relax. We'll get to the bottom of this. I'll just, after the x-rays, we'll see what happened. But this looks like a fracture. So maybe you can try to remember if she fell, or she probably, does she sleep with you?
No, she sleeps in her crib.
Okay. Okay, I'll send in some x-rays and I'll send in the social worker.
Okay, thank you, doctor.
You're welcome.
Good morning, doctor. So what's going on?
Okay, so there's this mom in this room, and I think she's abusing her baby. The baby has a fracture. It looks like she has a fracture. The mother is denying postpartum depression. It's her first child, and she's not saying what happened or where it came from. She's denying that the baby fell, or that she's denying everything.
Okay.
So, I want you to go ask her some questions,
Sure.
Do what you do, but yeah, this looks like a child abuse.
Okay. All right. Well, I'll go in there and I'll ask her some questions, and we'll see. We'll see if she confesses.
Okay. Thank you, Janet.
Hello, Ms. Carpentier.
Hi.
My name's Janet, and I'm a social worker. I'm here to ask you some questions about the fractures on your baby.
I don't know why they called you. I wouldn't hurt her.
Okay. Well, what happens at home? Do you have any problems with your husband?
No, we're happily married.
Okay. Do you have any problems with drinking?
No.
Okay. How about your husband?
No.
Okay. Does she sleep with you guys?
No, she sleeps in a crib.
In a crib? Okay. Do you fall asleep maybe when she's with you and you doze off?
No, I would never do that.
Okay. Do you have any postpartum depression? Are you feeling angry, or do you sometimes want to hit your baby?
No, not at all.
Okay.
Not Daisy.
Okay. All right. How about when you change her diaper? Do you ever leave her unattended?
No.
How about when she starts crying? Does it anger you so much that you maybe just want to shake her and make her stop?
No, I mean when she's been irritable lately, and I don't know how to soothe her, but I would never shake her like that.
Okay.
I just rock her like this and just, sing to her.
Okay, well, I'm going to gather all the information that you gave me, and I'm going to talk to the doctor, and I'm going to write my report, and we'll see where we go with this. Okay? Thank you.
Thanks. Daisy, I would never hurt you.
Hi, this is Dr. Cabrera. I am going to be making a report on Daisy. She is a 2-month-old infant. She was referred to me by Dr. Carranza. She has referred the x-rays to me for review and suspicion of child abuse. and possibly other metabolic disease. So I am going to be making a report. After review of the x-rays, I have concluded that this patient may have Osteogenesis imperfecta, and I am ruling out child abuse due to the facts that there is multiple fractures, there is a decreased bone density, there is pencil thin cortices, and also multiple fractures. Okay, so I am ruling this out because there's evidence of bone disorder instead of child abuse.
Come in.
Hi, Ms. Carpentier, how are you?
Hi, good,
I'm Dr.
thank you.
Cabrera.
Hi.
Nice to meet
Nice
you.
to meet you.
Hi, I'm here to give you the X-ray impressions and the results of what I concluded.
Okay.
And it was referred to me by the doctor. So one of the things that I needed to rule out was that they had said that there was a possibility of child abuse.
Yes, which is crazy. I would never hurt her.
Yeah, and after reading the X-rays, I have concluded that there's something going on other than that. And what the disease that I've come up with is Osteogenesis imperfecta, which
What's that?
It's basically what they call the brittle bone disease, and it's a genetic condition. And basically what happens is the bones are not calcifying because of the collagen. It's not forming the right way.
Okay.
So that's why the baby basically has a lot of fractures.
Okay.
There's different stages of this disease, so we'll try to figure out what stage she is in. But basically we're gonna have to be really careful with the baby to prevent more fractures.
Is she gonna be okay?
She's gonna be okay. There's people that live long lives with this disease. We'll need to manage it the right way, but yeah, we'll refer you to a specialist. And but like I say, you don't need to worry. I know that there was suspicion of something else going on.
Yes. Oh my gosh, I would never hurt her. I'm so glad they ruled that out.
Okay, so the radiology findings on an X-ray for Osteogenesis imperfecta is pencil thin cortices, which is the outside of the bone. You will also find multiple fractures that can be on the lower extremities or the vertebral bodies. The fractures are very frequent, like I said, in the lower extremities, and they are transverse. The healing leads to shortening of the extremities with a bone deformity and callus formation.
Okay, well, first of all, I want to say I'm really sorry. The x-rays came back,
Okay.
and it seems like she has osteogenesis imperfecta,
Okay.
and that's a bone disease. And so we're gonna rule out child abuse.
Oh, thank God. I would never
Yes.
hurt her.
I know. I'm sorry. I'm sorry,
Okay,
but
that's okay.
okay. So we're gonna do some collagen bone test and a gene test.
What were those for again?
These are to see up to what degree she has the disease.
Okay.
Okay.
What, did I do something during pregnancy?
No. This is just a gene mutation. There's nothing that you did, while you were pregnant.
Okay.
Or it's just a gene mutation. So I'm gonna send in a nurse to give you more information regarding how to take care of the baby. We have to be very careful, So what you're gonna expect to see are more fractured bones in the future. The sclera of her eyes will be blue. She will also have translucent skin due to the lack of collagen.
Okay.
She will also have excessive sweating. She'll have a triangular shaped face. She'll have a barrel chest due to a barrel chest.
Malformation.
A barrel-shaped rib cage due to the malformation of the bone. So these are signs and symptoms that you are going to see in the future.
Okay.
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 So I'll bring in a nurse to guide you regarding as far as the safety, the safety in your house for the baby.
Okay.
And also I'll bring in a dietitian to inform you regarding what types of foods are good for the baby, while she's growing up also.
Okay.
Okay?
Okay. Thank you so much,
You're
doctor.
welcome.
So my name is Jenny and I'm the nutritionist.
Okay.
And today we're going to talk about your baby's nutritional needs, okay?
Okay.
So for now, since she's a baby, Are you breastfeeding?
Yes.
That should be good, and also her formula, right? Or are you?
I'll switch to formula, but not right now. Right now I'm just breastfeeding.
Okay, so either or, it's fine.
Okay.
That's what she needs for now.
Okay.
And as she grows up, she's gonna need a balanced diet.
Okay.
Like I would say, low salt, added sugars, and most importantly, high calcium.
High calcium? Okay.
Because calcium, food with vitamin D will help absorb the calcium, and
Okay.
as you know, what she's going through,
Yeah.
it's gonna be so helpful for her.
Yeah. Okay.
Okay, and
What kind of foods have calcium?
I would say milk, and doctor will also give you another source,
Okay.
probably vitamins, extra vitamins due to her condition.
Okay.
And let's talk about her weight.
Okay.
It's very important that she doesn't gain much weight because of the bone problems that they already talked to you about.
Yes.
So we don't want that to make it worse on her by her gaining so much weight.
So if she gained a lot of weight, that could cause a fracture too.
Well, remember her bones are per se weak.
Mhm.
So excessive weight will make it worse.
Okay.
Okay? It will impede her mobility. As it is, she has a problem. You know, if anything touches her or excessively, she can make it a fracture. It can be a fracture, right?
Right.
So that's why we encourage for parents not to have the baby gain so much weight.
Okay.
Okay?
Okay.
And as you know, osteogenesis imperfecta is a genetic disorder, and there's no foods that will cure it per se,
Okay.
but we can help her with her, development.
Okay. Okay. Thank you so much for your help.
Hi, Mrs. Carpentier. I'm Crystal. I'm your nurse today.
Hi.
Hi, little Daisy. So, the doctors came in and talked to you and the radiologist about the x-rays. So I'm here to tell you about what you need to do at home.
Okay.
So at home, you need to safety-proof your house. Try to keep less rugs so she can't trip over it as she grows. Maybe padding corners. Sharp parts of furniture need to be maybe rounded or padded.
Okay.
Try to keep the clutter to a minimum. Anything that she can trip over needs to be avoided.
Okay.
Stairs. If she can have her room downstairs,
We have a single story.
That's great. And then so it's just to minimize any possible accidents that might happen to her. Since she is so brittle, we want to avoid that. And when it comes to clothing, that needs to be fitted right. If it's too tight and you have to move her arms too much or legs to get in, that can cause a fracture easily. We need to avoid that.
Okay.
Also, whenever you're changing her diapers, don't lift her legs up and do it. You need to lift her by the biggest parts of her body.
Okay.
Don't pull her by her armpits.
Okay.
No twisting, no yanking. She's very, very brittle, and you need to avoid doing these
Okay.
things.
I was changing her by her ankles, like you had said.
Which-
Okay.
All parents do that, but you didn't know that she had this disorder. So now we just need to work on avoiding making any more fractures.
Okay. Okay.
She, as she grows, she might need to have braces or crutches or wheelchairs, but
Okay.
we'll figure that out as we go. The specialist will help you determine how her disorder is, and then we'll go from there. But just be prepared for that.
Okay.
It's very livable. She can go to school.
Okay. Can
She
she play sports?
She needs to avoid any contact sports.
Okay.
She can do swimming.
Okay.
She can do track. Things that are not going to put too much risk for her to get injured. Football is out of the question.
Right.
So-
Okay.
You're just going to have a little bit more a swimmer instead of a football player.
I'm okay with that.
Okay. Any other questions?
Yeah. What about like future surgeries? Like, is she gonna have to have surgeries at all?
She possibly could. When it comes to children with this disorder, they can grow up and break their bones very easily. And if it doesn't heal properly, they have these things they can put in. They're called rods. So if in her femur she breaks it and it's not healing properly, we put in these rods. Some of them she can grow with, and some of them are just temporary till the bone heals.
Okay.
So there could be possible surgeries in her future, but we'll get there at that time.
Okay. Okay.
There's also a couple other things that are a really good idea. When you're bathing her, they have these gel pads that you can put in the tub. So that also helps to prevent her from knocking into the bottom of the tub or hurting herself. So if they'll give you a sheet of all these preventions.
Soft kitty, warm kitty, little ball of fur. Happy kitty, sleepy kitty, purr, purr.